Hello everyone, and welcome. Today we are going to take a calm and patient walk through an important health topic that affects millions of older men around the world, the prostate, and a modern treatment called Prostatic Artery Embolization, or PAE. Many of you watching are in your 60s, 70s, or 80s. Some of you may already be struggling with frequent urination at night, weak urine flow, or constant bathroom trips during the day. Others may be here for your husband, father, or friend. My goal in the next 40 minutes is to explain everything about this condition and this treatment in the clearest, simplest way possible. I will speak slowly, I will avoid complicated words, and I will always give easy examples when I need to explain medical ideas. Please imagine we are sitting together in a quiet living room, having a friendly conversation about health and life. That is the tone I want to use. The prostate is a small gland in men, about the size of a walnut, located just below the bladder. The bladder is the organ that stores urine. The urethra is the thin tube that carries urine from the bladder out of the body. The prostate surrounds this tube like a ring around a straw. In young men the prostate is small and causes no trouble, but as men age the gland often becomes larger. By the time a man reaches 70 years old, about 70% of men have some degree of prostate enlargement. Doctors call this condition benign prostatic hyperplasia, or BPH for short. Benign means it is not cancer, hyperplasia means growth, so benign prostatic hyperplasia simply means non-cancerous growth of the prostate. When the gland becomes bigger, it presses on the urethra, just like squeezing a straw. When a straw is squeezed, liquid does not flow easily. In the same way, urine has difficulty passing through. This is why older men often notice weak urine flow, difficulty starting, the feeling that the bladder does not empty completely, and waking many times at night to urinate. Imagine having to get out of bed 6 or 7 times every night. Sleep becomes broken, energy is lost, and over time this can even harm the kidneys. Life quality suffers, not only for the man but for his family too. Traditionally doctors used a few methods to treat this problem. The most common is TURP, transurethral resection of the prostate. In this procedure, a special instrument is passed through the urethra to cut away extra tissue and open the channel. TURP is effective, but it is still surgery. It can cause bleeding, requires anesthesia, and may keep the patient in hospital for several days. For many older men with heart problems or on blood-thinning medicine, this can be risky. Another method is laser treatment, where a green light laser burns away prostate tissue. This avoids some cutting, but can cause burning sensations, and tissue sometimes grows back. A third method is stapling or Urolift, where tiny implants pull prostate tissue to the side to widen the channel. This helps some men, especially with smaller prostates, but not everyone. Each of these methods has benefits, but also risks and limits. Now let us move to the focus of today, prostatic artery embolization, PAE. This is a newer and gentler treatment. Instead of cutting the prostate, doctors reduce the blood supply to it. Every part of the body needs blood to grow. If blood supply is reduced, the organ becomes smaller. That is the key idea. In PAE, the doctor makes a very small cut, usually in the groin or sometimes in the wrist. Through this, a thin flexible tube called a catheter is inserted into an artery. Guided by X-ray imaging, the doctor moves this catheter into the arteries that feed the prostate. When the catheter is in position, the doctor injects very tiny particles, like grains of sand, called embolic beads. These beads block some of the blood supply. Without that blood, the prostate gradually shrinks. As it shrinks, the urethra is no longer squeezed, urine flow improves, and symptoms become better. To picture it simply, imagine the prostate as a tree whose roots are blocking a water pipe. Instead of cutting the tree, you block some of the water hoses feeding the roots. Slowly the tree shrinks, and the pipe is free again. That is how PAE works. Now, let us talk in detail about the treatment process, step by step. The first step is consultation. The doctor will listen to your symptoms carefully. How many times do you wake up at night? Do you strain when urinating? Do you feel urgency? Do you ever leak? Sometimes you may be asked to complete a questionnaire, a simple set of questions about your urinary habits. This helps measure how much the enlarged prostate affects your life. There are no right or wrong answers. It is just a tool to understand your situation. The second step is testing. An ultrasound may be done to check the size of your prostate. You may be asked to urinate into a special machine that measures how strong and how long your flow is. Blood tests may check kidney function and prostate markers such as PSA. Sometimes, a CT scan or MRI is used to see the arteries around the prostate. These tests are not painful, they are simply pictures and numbers to help the doctor plan carefully. If everything looks suitable, you are invited to schedule the procedure. On the day of PAE, you arrive at the hospital or clinic. You change into a gown, and a small line is placed in your arm for mild sedation. You are not put to sleep like in big surgery. Instead, you are awake, calm, and relaxed. The skin near your groin, or sometimes your wrist, is cleaned and numbed with medicine. You may feel a pinch, but after that you feel almost nothing. A thin catheter is inserted into the artery. Using X-ray imaging, the doctor gently guides it inside the vessels, just like following a road map. A little contrast dye may be injected to make the arteries show clearly on the screen. You may feel a warm sensation, but not pain. Once the catheter is in the correct artery, thousands of tiny beads are slowly released. They flow into the prostate's blood vessels and block them. This is repeated for both sides. The whole process usually takes 1 to 2 hours. When it is done, the catheter is removed and pressure is applied to stop bleeding. A small bandage is placed. You rest for a few hours. Some men go home the same day, others stay overnight. For a few days you may feel mild burning, a little blood in urine, or mild fatigue. These effects usually fade quickly. Most men return to normal activity within a week. Let us imagine the story of Mr. Smith, a 74-year-old man. For years he woke up 5 or 6 times every night. He was exhausted, his wife was also sleepless, and he stopped traveling with friends. Pills gave him side effects, and surgery was too risky for his heart. He chose PAE. On the day, he was nervous, but the doctor explained step by step. The catheter was placed, the beads were injected, and within 90 minutes it was finished. He rested overnight and went home. A week later he already felt improvement. 3 months later he was sleeping through the night, full of energy, and back to enjoying life. His wife said it gave her peace too. Stories like his are becoming more common as more men discover PAE. Who benefits most from PAE? Men with moderate to severe symptoms, especially those who cannot have surgery, are ideal candidates. It also works well for very large prostates. Men on blood thinners, men with diabetes, or lung or heart disease may find PAE safer than traditional operations. However, it is not used for men with prostate cancer. It requires doctors trained in interventional radiology, so not every hospital offers it yet, but availability is increasing worldwide. How effective is PAE? Studies show that 70 to 80% of men experience major relief. Prostates shrink by about 30 to 40% within 6 months. Nighttime trips fall, sleep improves, energy returns. For most, the benefit lasts 3 to 5 years, sometimes longer. If symptoms return, PAE can be repeated. Side effects are usually mild and temporary. Serious risks are rare when performed by experienced doctors. Now let us talk about life after PAE. The greatest gift is sleep. Men who once woke every hour now sleep peacefully for 6 or 7 hours. With sleep comes better mood, sharper memory, stronger body. No longer tied to toilets, men can travel, meet friends, and live without fear. Families feel the difference too. Wives rest better, children worry less, and the whole household is calmer. PAE not only heals the body but restores dignity and confidence. After PAE, doctors recommend simple healthy habits. Drink enough water but avoid too much at night. Reduce caffeine and alcohol, which irritate the bladder. Keep a healthy weight and stay active with gentle exercise. Manage constipation, because straining can worsen urinary symptoms. Follow-up visits at 1 month, 3 months, 6 months, and 1 year help the doctor check progress. These visits are important, not only for medical checks but for encouragement. Think about this, 50 years ago men had few options. Many suffered in silence or went through risky operations. Today, we have this gentle, modern option. It is not magic, but it feels magical for many men whose lives are transformed. This is progress in medicine, not just longer life, but better life. So if you, or someone you love, is suffering from frequent urination, weak flow, or broken sleep, remember, you are not alone, and you do not need to suffer in silence. Talk to your doctor. Ask about prostatic artery embolization. It may be the gentle solution you have been waiting for. You are never too old to seek comfort, never too weak to hope, never beyond the reach of healing. Thank you for spending this time with me. May you find rest, strength, and peace.